can breast MR replace X-ray MR
no.
as a screening tool?
No. Breast MR is not a screening tool. It is only used for screening in patients who are BRCA1, BRCA2 positive and require screening for multifocal disease. But otherwise, all screening is X-ray screening, mammography screening.
When you said sonomammography is a diagnostic tool, what is it used for?
So when you find something in the breast, lesion, then you use ultrasound to see that lesion and figure out if the combination of X-ray and ultrasound can give you a better understanding of what it might be. Because your main role when you're imaging the breast and you find something is to try and filter out the benign lesions, right? Which means nothing further needs to be done. So they have this BI-RADS classification of 1, 2, 3, 4, 0, 1, 2, 3, 4, 5, where 5 means it's definite cancer, of course, has to be proven on histopath. 1 and 2 means they are benign, nothing further needs to be done. 3 is indeterminate, so usually 6 months follow-up. And 4 is likely to be cancer, so a biopsy is required, but it may still turn out not to be cancer. So their whole aim is to classify into one of these criteria, and if it's 1 or 2, then you tell the patient that, listen, you may feel a lump, you may have something, but not to worry, it's perfectly all right. There's nothing to be done. It's all good. If it's 3, then women get very worried because we may have cancer. Why are we being made to wait for 6 months? But you're being made to wait for 6 months because the chance of malignancy is less than 5 to 10%. So somebody has to counsel the patient to say, listen, because your chance of malignancy is low and biopsies are not without complications. Biopsies may not sample necessarily the right area, and if the chance that on follow-up the lesion will regress is high, then you don't need to go ahead and do something drastic. With 4 and 5, you have to actually tell the patient that, look, don't wait for more than a week or 2, don't not do anything, and get something done. I know that there are Ayurveda and homeopath physicians in the audience as well, and I think everybody does their job the way they are supposed to do, but let's be clear, with things like breast cancer, breast lumps, the first modality of choice has to be the current protocols developed with modern medicine. It can't be that you have a mass which is BI-RADS 5, and then they go to somebody who says, I am an Ayurvedic oncosurgeon and I will treat your lump with a leaf that I will put on the breast, and the lump will get, will dissolve or will come into the leaf in about 3 months or 6 months, and all of that stuff that happens. So in fact, radiologists like Bijal, and she's not the only one. In this area, there's Yojana Nalaude, there's Geeta Shah in Andheri. They talk to the patients and they also counsel them that, listen, you need a biopsy. If the biopsy is positive, then you will have to see an oncosurgeon. They don't give names, but they will say that this is the path that you would have to follow, and then take it from there. So all of these things are often done by the radiologist because there's nobody else to do any of this.
Forward. What is